If you bring a new gadget that measures your sleep, except that it tells you how much and how well you snoozed and help you score a better night's rest, right? Not so fast. Some experts say that these sleep trackers don't offer a true picture and may actually undermine your slumber. According to scientists speaking to the New York Times, sleep monitoring apps and devices can exacerbate insomnia by providing erroneous data and exacerbating anxiety. This is leading to an upsurge in people worrying about a sleep disorder that may not even be there in a condition referred to in the Journal of Clinical Sleep Medicine as orthosomnia. And people who don't often get enough sleep have a far higher risk of heart disease or stroke than those who sleep 7 to 8 hours each night, even may have an aging brain. So, you may have asked what the true mechanism of sleep trackers causing insomnia. We gathered some facts to insight this concerning issue, but before discussing, let's talk about what are sleep trackers. Sleep monitors assist you in keeping track of your sleep. They're available as separate sleep tracking smartphone apps or as part of a fitness tracker or smartwatch's feature set. In their most basic form, tell you how long you slept and how well your sleep was. For example, whether you woke up during the night at all. Other sleep trackers also have listening capabilities, which can detect snoring or sleep apnea sounds. And some claim to be able to tell you how much time you spend in different stages of sleep, such as light or deep sleep. How do these devices promise to be able to share information? The accelerometer in your smartphone, smartwatch, or wearable device is used by sleep trackers. Accelerometers are devices that track your movement. If you don't move, you're probably sleeping. When you move about when you wake up in the morning, your accelerometer detects this and determines that you are awake. This appears to be a simple task, right? Sadly, investigations demonstrate a fundamental absence of supporting evidence for the promised functionalities and benefits in the bulk of the devices, time and time again. The distinction between sleep and wake movement is rather obvious. According to several studies, sleep monitors are fairly accurate when it comes to calculating overall wake time. Observing your brain waves rather than your movements is the greatest approach to discern between the various stages of sleep. To monitor your sleep and identify a sleep problem, sleep technologists will look at your brain waves as well as other critical processes, including breathing, heart rate, body and eye movement, and oxygen levels in a sleep lab. In general, these devices may not be able to reliably detect sleep stages or identify brief periods of alertness following the onset of sleep. Sleep measurements can be modified, and they may or may not match sleep science. Important sleep information, such as breathing issues or aberrant movements or behaviors, may be missed by these devices. Though, according to Fitbit and what other firms think, the threat of anxiety is just overblown. Fitbit research director, Dr. Connor Hennigan, claimed that only a small percentage of people suffer from severe sleep anxiety. He claims tracking sleep helps emphasize the necessity of having consistent bedtime and waking time. And it can also highlight the impact of things like alcohol and exercise on sleep patterns. The first thing to keep in mind is to stay calm. Even if you only get fewer than 8 hours of sleep, if you fall asleep fast at night and wake up close to your alarm, your sleep is almost definitely fine. And regardless of what your app says, if you get enough sleep but still feel exhausted, consider other factors such as your lifestyle, nutrition, and stress levels rather than relying on just sleep quality. Insomnia can be avoided if necessary. Some people may want to avoid wearing wearables that track this type of health information. This may be the ideal option if you have an obsessive personality with neurotic or worrying tendencies. In some situations, you may need to seek the help of a sleep specialist to get back on track. So, tell us which sleep trackers you recently used. Did you face any sleep problems regarding using this sleep tracker?
Thanks for watching our video. For more healthy experiences, subscribe to our channel and keep yourself updated by pressing the bell icon.